Hi everyone, I'm Victoria Knight. I co-author our Axios Pro Healthcare Policy newsletter with my colleague Peter Sullivan, who you'll hear from in a bit. Our newsletter delivers real-time policy news and congressional insights for the healthcare industry. So if you're interested in subscribing, be sure to head to axios.com/pro to learn more. Up next, another leading voice from Capitol Hill. He's the co-chair of the GOP Doctors Caucus, a licensed urologist. Please welcome North Carolina Congressman Greg Murphy. Thank you, Congressman. Thank you for being here.
Absolutely. Is everybody awake? We pulled an all-nighter last night in Ways and Means, so if I nod off, no, I'm not going to. So.
You took my first question. I was going to say, how much sleep are you running on?
None.
Is there anything big happening on Capitol Hill today?
No, it's a bunch of lollygagging.
Not too much. Not one of the biggest weeks in healthcare, I feel like, in a while. So obviously, reconciliation and markups are all the talk of Capitol Hill this week. Ways and Means, which you're a member of, just passed their portion of the reconciliation bill this morning. There were some GOP healthcare priorities in the bill. I feel like they weren't really touched on as much, or maybe covered as much, because everything was talking about tax, right?
Yeah.
So I'm curious, what are your thoughts of those provisions that were in the bill, and how do they kind of help push the GOP healthcare agenda forward?
Sure. I'll look at my three personal priorities. I'm a surgeon by trade. I actually still see patients because I think it helps me. First of all, I love what I do. I think my patients appreciate it, and it helps me stay relevant in the world of medicine. There are three things I'd like to accomplish. I want to stabilize our physician fee schedule. I think it's personally ridiculous that we've now propped up insurance companies, we've propped up hospitals, and we don't pay the people who actually deliver the health care in the country, and I say that from my colleagues. So second of all, we need massive health insurance reform. Sorry for any of their health insurance people out here, but you guys have the biggest lobby in this town, and it is a chokehold on American medicine. Third, I could have third, fourth, and probably fifth. There's some things we do in medicine that are pretty antithetical to what we're doing delivery of care. One of my pet peeves is direct consumer advertising. We're one of two countries in the world that do it. I've never, in 35 years, prescribed a drug because one of my patients saw it on television. And it drives up costs and it drives up utilization because the worried well love to come in and drive up costs. And so we have to get control of what we're doing with our healthcare dollar. You know, if you've heard from some of the other folks here about our results of what we're paying for in medicine in this country and healthcare, it's ridiculous. And so trying really to get a handle on this, I'm an equal opportunity offender in everybody in the healthcare space because I want it to be the best in the world and also the most affordable in the world.
So if you had to describe the GOP healthcare agenda in just a few words, how would you describe it and the vision from Republicans?
Yeah, you know, I think if you have to pick one word with the administration that we've had so far, it's accountability. It's a reset. You look at our nation's history in the last 250 years, we've actually never done this. I ran a practice. People have run businesses. We always sit back and doing those things. You sit back and say, what are you doing right? What are you doing wrong? And I think if you have to look at our healthcare system, what are we doing right? What are we doing wrong? Why are we pouring hundreds of billions, if not trillions of dollars into a system that is not delivering the best healthcare? We have some very poor outcomes compared to the world, and we're spending trillions of dollars to do this. So we're trying to be accountable to this, both in the Medicare space as well as in the Medicaid space. We need to deliver the product to the individuals who deserve those benefits, who are eligible for those benefits, and get back to actually making sure that the doctor-patient relationship is primal.
And you just mentioned Medicaid. That was going to be my next question. So it's a huge topic in Congress this week.
Sure.
R-N.C, I think, Energy and Commerce, is finishing up their markup as we speak, I believe.
They're a little slower than Ways and Means. We're much better than they are.
Yeah, Ways and Means, was it 17 hours? Is that right?
Yeah, we were much more efficient.
Yeah. Energy and Commerce is going on 25, I believe. So
a little slow over there.
What is your view, though, on, I know you're not on the committee, but you're going to eventually vote on this bill,
sure.
On the changes to the Medicaid program that R-N.C is proposing, and there's quite a bit. There's you're freezing provider taxes. There's a cap on state-directed payments.
Yeah.
There's work requirements, federal work requirements for the first time. What are your thoughts on how this will change Medicaid?
Sure, and let me just preface it by saying I've worked at the bedside, I've run a surgical practice, I was chief of staff of a close to 1,000-bed hospital with 9 other hospitals. I was the senior chair of health policy in North Carolina, so I kind of know the A to Z to this. It's okay for us to look at a system, during the Biden years, no state was allowed really to audit its Medicaid rolls. There are eligibility requirements, pregnant females, impoverished children, disabled or impoverished seniors. Those are the eligibility criteria for who should be in Medicaid. So if you're not allowed to audit the rolls, you had at one point in time 1 in 4 Americans on Medicaid. I still see patients. Actually, my practice has been a very, very poor payer mix, 74% government, either Medicare, Medicaid, or no insurance. I see these patients on a daily basis, and while most fit the criteria, the eligibility criteria, I still see individuals who I know should not be on Medicaid. We just have to get back to a system where we're delivering the product for the individuals who deserve this. So I think what R-N.C is trying to do is a couple different things. The main thing is to slow the growth rate. It's a sad fact in the state of North Carolina right now, 52% of the births in the state of North Carolina are born to mothers on Medicaid. How did we get there? How did we get there to that particular spot? So that's a criminal indictment of what's going on in healthcare. It's a criminal indictment of what's going on really in our fertility system. How do we deliver where we can get it right? You look at where states have been, the hospitals have been taxing themselves, sending it up to the federal government to bring a bigger pay down. It's a gaming of the system. Do we need that to keep some rural hospitals alive? Yes. Should we have real rich hospitals gaming the system? They should not. And then also, if you look at what the other stabilization of of the payments should be, it's okay to look back and do this. The last thing I want, and I live in a very rural part of eastern North Carolina. Has anybody ever been to the Outer Banks? Thank you for bringing your tourist dollars down. Half the room rings up. It's great. But we have a lot of poor individuals that live in our part of the state. We want to make sure that they're taken care of. But we need a system that is robust, that is definable, that is sustainable to make sure that we deliver the health care to the individuals who qualify.
The Congressional Budget Office is estimating that these changes in the Medicaid program could result in millions more people losing health insurance coverage, though. Democrats are already messaging on these numbers. Do you think Republicans need to have an answer on how to address those who may be uninsured?
Yeah, guys, I'm a scientist at heart. We're taught in medical school, at least we used to be taught in medical school, when you pick up a journal not to believe a damn thing in it. I've been very, very disappointed in the Congressional Budget Office. I really have. They said, the IRA was going to cost $300 or $400 billion. It's over now $1.25 trillion. I just can't believe their numbers. The last thing is, I don't want people kicking off who should be eligible. If you look at states like California, they're allowing individuals on Medicaid who are not by definition, they're asylees, they're people who have supposed to be deported, that have not left the country yet, that are eligible for Medicaid. Those individuals should not be here, or should not be on the system. We had a debacle, and I think this is an 80-20 issue of what happened during the last administration, allowing, depending upon what you count, 11 to 20 million individuals come in the country illegally. Why we're providing health care to those when we can't provide it to our own individuals, our own people, I think that's an indictment of a system. We need to get back to, again, making sure the system is there for those American citizens and American people who qualify for those benefits, making sure that that is a deliverable product.
You got one of your reconciliation priorities in the in the Energy and Commerce bill, the inflationary fix for the Medicare physician payment cut.
Yeah.
Is that enough for you, that
No.
inflationary fix, or are you hoping for more?
It's not. It's and believe me, I'm glad they tried. There are 3 components to that. Number 1 is fix the fee schedule. It's a 2.62, I believe, % cut this past year. If you look at what's happened to the fee schedule, it's been over the last 20 years about a 30% decrease. Guys, my practice, when I had to resign from it, my younger partners, we had gone several quarters without taking a paycheck. When you own a practice, when you own a business, you pay your light bills, you have to pay your staff before you take a paycheck. And my younger partners, when I had to resign, I said, here, let me turn it over to you. This is how you stay private. And they said, no, we can't do it anymore. It's terrible, because I think employed physicians, God bless, we have them. It's now 70 or close to 80%. They don't work as hard. They cost the system more, and it's not as an efficient part of practice. And so if you look at where we're trying to go, we need to get the physician fee schedule stabilized. Number two, there has to be an index for inflation. And then also, CMS has utilization reviews. If it triggers a certain point at 20 million, all of a sudden the new formula kicks in, and then all of a sudden you'd kick out another cut. I've tried to introduce, or I have introduced, legislation to put a bigger window in there. I'm happy that R-N.C. at least helped with the MEI index, but it's not enough for me. It's 8.9 billion. It needs to be 15 to stabilize the system. There's no reason our docs should be flat-footed from the past cuts of the last 2 years. And I've made that known. It's not a big ask, good gosh. When we have the SALT people that are asking for $1 trillion, it's not enough. It's not too much to ask to actually let our people survive on the Medicare patients that they're kind enough to see.
What is the next step for trying to get that full doc fix that you're wanting?
Well, I could stand and be on the House floor and rant and rave like some of my colleagues do. I'm not that kind of guy, but I've made it very clear to leadership I'm not going to vote on a product that doesn't fix it completely.
Okay.
Yep. Sorry. Sorry, not sorry.
Is that your red line?
I'm not one of these red line people, but this is my, let's say, beige line. I'm not going to split hairs. This needs to get done. Yeah. It needs to get done. I've been here, 5.5 years? It seems like I've been here like 400 years. But I'm tired of dealing with this year after year after year and seeing it in the face of the people who are up at 2 o'clock in the morning taking care of your grandmother. It's time that we fix this system. It's ridiculous, and we're giving hospital bumps every year. We're giving insurance company bump. I mean, hell, the MA program's got a 5% bump last month. Don't get me started on MA either. I've already been up. I'll be cranky. I'll be cranky as hell because I'll talk about that.
Well, you may have the chance now.
Oh, look out. Everybody take their tongue.
More broadly, if you think about this current moment in time, there's a lot of consumer anger at health insurance companies. I think we've all seen that, especially, a lot around the price of healthcare as well. What do you think the GOP answer should be for addressing these patient concerns?
Well, let's pick on Medicare Advantage. All right, that's it's an easy one to pick on because they've created a target on themselves. This was a program, it was a good program. You want to go into people's homes, you want to see where their health care is, what their needs are to try to keep them out of the hospital, keep them healthy. It was supposed to be 95% of fee-for-service. It's now 120%. And the problem is you've had companies, sorry, I'm just going to call it out, United, that have taken advantage of a system. They go in and you can walk into somebody's house who's stone cold healthy, and they'll come out with 15 diagnoses to the tune of $50 billion of upcoding for people that had, quote, diseases that never received medical treatment. And so it's these aberrations, and it's fraud, if you ask my opinion of fraud. It's not illegal, as I was told by one of their CMOs, but it's fraud. It's taking advantage of a system that was not supposed to be that way. And we have to go about that. The American people are demanding it. And sadly enough, you see on television, you see good old Joe, who was Joe? Name it, thank you. I was going to say Montana, but I've been up a little while. But you see that, you see JJ, people that, senior people trust, but they're delivering a product that, first of all, is deny, deny, deny. And I can give you a personal story about that, but I won't bore you. It's deny the health care and then not pay the people who deliver the health care, and guess where the profits go? To people in the insurance industry. We got to stop that nonsense. No one else in the world does this. And the middleman, as I've said to the president, is destroying American medicine. So let's get back to where the doctor-patient is the most important thing and let the pharmaceutical industry and the health insurance industry stay in their lane, do their job, make their profits, but not squeeze out everything from the system.
You also mentioned, I think at the top, that you're really passionate about cracking down on direct-to-consumer advertising of pharmaceuticals. Tell me why and what your solution would be for
Well, I tell a little story about, 12, 15 years ago, I had a patient come into me and he looked at me quite smugly. He says, "Doc, I know what drug I need." I was like, "Oh, really?" So he pulls out this little piece of paper he'd written down. He saw this great ad on, this is the drug I need. And I was like, "Oh, wow, you're just a genius." And he looks at me and I said, this is a great drug. And he looks real smug and I said, "It's just one problem." He said, "What's that, Doc?" And I said, "You don't have that disease." So this is a problem. We're one of 2 countries in the world. They spend, zillions of dollars on this. The advertisers hate that I'm going after it because guess who pays for the midnight or the evening news? But I'm so tired of the fact that every American in this room, every person in this room knows what Keytruda is, right? Raise your hand if you ever heard the drug Keytruda. All right, come on. Some of you are lying. You've heard it. And so it's not delivering anything of value to our system in healthcare, and it's causing a ridiculous cost to healthcare. And that's just one of the things that we just don't need in America. We just don't need it. And so the other country is New Zealand, where you have 4 million people and 16 million sheep, and who the hell needs it over there either? So I think RFK is online to do something about this. It's a First Amendment issue, but you know what? I love our pharmaceutical industry because I've seen in the last decade the magnificent cures that we have had to people. I used to tell people, I used to have the discussions, it's time to get your affairs in order from cancer. And a lot of times I don't have to have that discussion now. I can say, hey, you're going to see your kids graduate from college, or hey, you're going to see your grandchild get married. And so there have been such wonderful advancements. Let's not pollute the system with things that don't provide any value.
So would your solution be to ban these type of advertisements completely?
We don't need it. We don't need it. I need it in my medical journals because I'm the target audience. I'm the one who's making decisions. That's where patients trust their doctors, or they're supposed to. And they're the ones who come to us for our opinion. That's what your doctor's supposed to do. We don't need it on television.
All right, we're already over time because we've been having such an interesting conversation, but I get to ask one fun question before we go. You hold multiple titles as you're both a physician and a member of Congress. Which title do you prefer?
It's funny. When I first got to Congress, my staff said, well, what do we call you, doctor or congressman? And I said, well, think about it for a second. If you look at levels of approval, always number one are nurses, doctors, and pharmacists, and then you have members of Congress way down here. And so they said, yes, Dr. Murphy. So, I feel really sad for the members of Congress who are used car salesmen because they're really screwed because they can't do anything down below. So.
All right, I've had it wrong all day then. Dr. Murphy, thank you so much for joining us. Thanks as always for being a part of the Axios conversation. We so appreciate it. I know you have to go to run to a House vote now, right?
Yeah, they have these damn things called votes we have every day. So.
Thank you guys so much for listening.
All right, thank you all very much.
Thank you.